It's been more than a month since the United Kingdom identified a new, more contagious coronavirus variant. Right now, researchers at the Centers for Disease Control are monitoring multiple variants in at least 33 states with 541 cases and counting. We check with the CDC for you. Right now, no variants are reported in Missouri. Illinois has at least one case of the British variant that was detected in mid-January in the Chicago area, and no cases of the South African variant. So what does that mean for you? Our Corey Stark is answering some of those questions right now.
Yeah, hey Sam, by now variant is a word you've probably heard over and over again, and experts call them a great concern. So the first question here, what has those experts most worried about?
The more infection there is in a community, in a country, the likelihood, almost the certainty that there will be variants. And the virus's goal is to survive, so it will be the strongest variants that will eventually survive.
The variants seem to spread more easily, and there's concern they could become more dominant in the United States by the spring. So the next question, are the vaccines effective against these variants?
Even though there is a diminished protection against the variants, there's enough protection to prevent you from getting serious disease, including hospitalization and deaths.
Of course, the big question at this time, because we've heard it from a lot of you, what if I can't get a vaccine right now?
First, wear a mask, stay 6 feet apart. Second, please avoid crowds and poorly ventilated areas. Third, now is not the time to travel. There is less virus spreading, and the conditions that produce variants are decreased.
So with all of this in mind, another question is, do public health measures and getting people vaccinated prevent future variants?
Viruses cannot mutate if they don't replicate.
There is light at the end of the tunnel, but it's going to be up to us to step to the plate.
So this is important to note when talking about variants. The CDC has been ramping up its process to identify additional cases of variants, but even the CDC director admits it's not yet at the level that it should be. Sam?
All right.